Assalamualaikum and hi. My name is Muhammad Muzaffar bin Muhammad Hisham. I am from BEU3A. My matrix number is 08 BEU20F 3014.
Hi, and my name is Reza Kacha Amatenta, and my metric number is 08BEU20F3012. The reproductive system of the body, and also known as a genital system, is a biological system composed of all body parts involved in sexual reproduction. Many parts of male and female reproductive system can be affected by cancer. In female, cancer can attack the uterus, ovaries, breast, and cervix, among other organs, according to the American Cancer Society. Several male reproductive disorders may affect the health and status of the overall quality for life for a man. And here we're gonna talk about the 4 diseases and also 4 treatments for all 4 diseases. We have a look. And here we're gonna talk about 4 different disorders, 2 for male and 2 for female. The male one is prostate cancer and benign prostatic hyperplasia, and for female is cervical cancer and uterine fibroids.
What is prostate cancer? Prostate cancer is cancer that occurs in the prostate. The prostate is a small walnut-shaped gland in a male that produces the similar fluid that nourishes the transport sperm. Second point is, prostate cancer is one of the most common type of cancer. Many prostate cancer grow slowly and are confined to the prostate gland, where they may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. For all treatment, we use radical prostatectomy. For hardly any other organ can the development of medical or medicine and technical advance in the last 150 years be so clearly illustrated as for the prostate. The history of radical prostatectomy was initially characterized by the problem in approaching this relatively difficulty accessible organ.
In laparoscopic prostatectomy, your surgeon places instruments into your abdominal cavity through small keyhole incisions, or ports. He or she dissects the prostate from its surrounding structures and removes the gland through one of the slightly widened ports.
Benign prostatic hyperplasia, or BPH, also called as prostate gland enlargement, is a common condition as a man gets older. The enlarged prostate gland can cause uncomfortable urinary system, such as blocking the flow of urine out of the bladder. If you have a BPH, your prostate gland is enlarged. The prostate is the walnut-sized gland in men beneath your bladder. Your prostate gland surrounds your urethra, the tube through which urine and semen exit your body. Your seminal vesicle and prostate make the fluid that combine the sperm cell to create semen. During normal urination, urine flows from your bladder through the part of your urethra inside your prostate, then through the rest of your urethra to leave your body for unknown reason. Your prostate gland may enlarge as you get older. If you have benign prostatic hyperplasia, your prostate may grow large enough to narrow the block, the part of your urethra that run through. As your result, your enlarged prostate may slow or block the uterine flow out of your body when you urinate. Transuteral resection of the prostate, or also called as a TURP, the conventional surgical treatment for BPH. This operation involves removing prostate tissue that is squeezing around the urethra or urine channel and obstructing urine flow. Removing this tissue opens up the urine channel, allowing urine to flow more freely. In this turn, allows the bladder to work less hard to empty, which reveals bladder symptom. The high-power laser used to vaporize the prostate tissue is also called as green light PV laser system. The green light is observed while the red pigment prostate tissue with the entire green light PV produced take only about 10 to 30 minutes to perform depending on the size of the prostate.
What is cervical cancer? Cervical cancer is a type of cancer that occurs in the cell of the cervix, the lower part of the uterus that connected to the vagina. Various strains of the human papillomavirus, or HPV, a sexually transmitted infection, play a role in causing most cervical cancer. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. You can reduce your risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. In modern treatment, we use trachelectomy. A trachelectomy is removal of the cervix, upper vaginal and perimetrium tissue surrounding the cervix. Pelvis lymph nodes may also be removed. It can be used to treat some cases of early stage cervical cancer in women who wish to keep their fertility and ability to carry a child. A pearl string stitch or cerclage is placed by the surgeon to create an artificial opening into the uterus. Since the cervical OS or holes is no longer present, this is done so that menstrual blood is able to pass. A catheter may be placed to keep the space open.
Uterus fibroic. Fibroic are muscular tumors that grow in the wall of the uterus or womb. Fibroic are not cancerous. Not all women with the fibroid have a symptom. Women who do have a symptom often find fibroid hard to live with. Fibroid can live as a single tumor, or there can be many of them in the uterus. They can be small as an apple seed or big as an apple fruit. In usual cases, they can become very large. Most fibroids do not cause any symptom, but some women with the fibroid can have heavy bleeding, or which can be heavy enough to cause anemia or painful period. Feeling of fulfillment in the pelvic area, lower stomach area, or enlargement of the lower abdomen. One option for treating uterine fibroid is a non-invasive MR guardian focus ultrasound ablations. The procedure uses MRI as a guardian for the radiologist to pinpoint the area in a core of the uterine fibroid where the ultrasound wave will be focused. When many ultrasound waves converge on the single area, it creates enough heat to destroy the tissue. The procedure is repeated over and over until the certain core of the fibroid is destroyed.
In conclusion, the human reproductive system is an example of sexual reproducing involved organ with respective function of male and female humans. The occurrence of fertilization, which is the process of fusion between male and female gamete, determine whether it will proceed to pregnancy or menstrual cycle in female human body. Hormones play an essential role to allow optimum development in certain aspects of either processes. The objective of the experiment, which was to identify male and female reproductive structure and to describe cyclical hormonal changes in women of reproductive age, were achieved through drawing a label diagram of female and male reproductive system and a line graph of hormone involved during the menstrual cycle, respectively. Bye. Thank you.